Welcome back, and thank you so much for staying with us right here on Amka Kenya. You are watching Amka Vibe Check, and like I mentioned to you right before the break, we are having a conversation about the drive that the Ministry of Health has had concerning vaccinations, which are urgent. That is measles, rubella, and of course typhoid. Now, Dr. Evans Mukoya is my guest this morning. He's a KENITAG member, researcher, pediatrician from the Kenya Medical Research Institute. Thank you so much for joining us, Dr. Evans.
Thank you so much for having me.
You well today?
I'm okay.
Amazing. It's good to have you here. I mean, it's a conversation that many parents or caregivers, even people who are concerned, you know, want to understand better, because we've seen there's been a drive for some weeks now. Yeah. And it's still ongoing. We've seen, you know, some children in some schools, or even just personally, you know, their parents taking them to the hospital to receiving vaccinations, right? So let's lay some groundwork. Okay. First of all, before we go deeper into the conversation, and the three matters here which are very important: measles, rubella, and typhoid. And there's been an outbreak, especially when it comes to typhoid and measles, right? Yeah. So we want to understand exactly why it's happening right now, and why some counties are affected more, you know, than others. So just give us that illustration of why now.
Okay. I'll start with the measles and rubella. One is that we routinely give children measles at around 9 months, and another repeat at around 18 months. And we find that over the years, we have not been able to vaccinate over 95% that is supposed to be vaccinated. We are supposed to reach the target. Okay. So if you vaccinate around 80% or so, a large number of children are left out. And after a certain time, you find that there's a large pool of unvaccinated children. So when measles, you get one child with measles, he can infect almost 9 out of 10. So if you got a large number, one child can, if he comes to a room where there are about 100 people who are unvaccinated and immunized, then almost 90% of them will get the disease. So now, over the years now, after every 3 or 5 years, the large number of unvaccinated goes up. Even for those who are vaccinated, not all of them get immunized. Probably about 85% or so will get immunized, another 15% are not. That's why we repeat. Yeah, the vaccinations.
I see. Yeah. All right. Now, there's also a big concern, you know, among parents. Others feel that, you know, it's not necessary, you know, per se. And you've seen this over time and time, that you'll find a section of parents saying, yes, indeed, this is fine. But others would say, and this is a study from way back in the 90s and even before, that it introduces other diseases. For example, I read one aspect of, you know, study that said some parents were fearing that their kids would get autism, you know, on the same. Now, it's been dispelled, but at the same time, there are people who still feel those fears are real, right? So I need you to give us a proper perspective. You know, is it that when, in some cases, truly, you do get side effects of introducing new diseases, and even conditions for that matter, or is it a myth that has not yet quite been dispelled properly?
There's some of the myth and some are just fraud. For example, the one for autism. That's a study that was done by a certain doctor called Andrew Wakefield in the 90s. And it was published in the Lancet, and it was found to be a fraud.
Yes, Lancet, yeah.
Yeah, so it was a fraud. All the information that was there, and it was actually it was removed. And but the people who are who are against the vaccine, you find they're still coping. Now the thing is that that vaccine used to be given at around the same period that autism becomes overt. So when they started associating with autism, but if you look for those who are not vaccinated and those vaccinated, there was absolutely no difference.
Oh, I see.
Yeah, between.
All right, so curious, is there supposed to be a specific time, even though, for example, right now it's nationwide, okay? It's an urgent call for, you know, vaccination. But if you have a particular condition, should you wait? Should you tell your child to wait? Or how do you go about it for those who have such concerns?
No, No, it does not. Does not cause any problem. Probably, if you are very sick at that particular time, you can probably hold on. But generally, vaccination is safe to almost every other person, and even for those who are probably autistic or other things, it'll help them from getting the disease. The side effects actually are very, very mild. The whole thing about it. Generally, as we were discussing before, that it is probably pain and redness, and if you're light, you can see on your skin where there's an injection site. That's the commonest thing that we see. A few people might get a little bit of fever, not many. A little bit of fever. For things like for the MR, very rarely you can get sometimes a mild rash that will not last for probably about 2 days and disappear. But majority of children have absolutely no side effects. Yeah.
Okay, but let's speak about the swelling and the fever.
Yeah.
For some parents, that's a no-no. Why is my child getting vaccinated and, there's a swelling? It feels like a numbness, where the injection. Where they got the injection.
Yeah.
And you find for some children, they'll feel nothing. For others, like you said, rightfully, they'll get the reaction.
Yeah, yeah.
Okay, so articulate exactly what happens in that moment and what should you do, and is it normal? Can we say, yes, there's a side effect, but should it even be there?
There are some side effects that we cannot avoid. They'll be there. But if you look at the disease itself, it's much worse. If you see, for example, like what measles does, you will get, apart from the rashes and red eyes and all those things there, you'll get pneumonia. You can get ears getting infected in the past, we call them otitis media. You can get your brain that can be damaged, that could be permanent, which can occur then or even many years later. And you can get your brain now disappearing from the disease. So if you look at the disease itself and then look at the mild side effects and the fever, probably one or so children with fever sometimes can have some very high temperatures, but majority of them, which might require antipyretic, but majority of them is just mild that can be ignored within 1 or 2 days. It's over. Yeah.
Okay. Let's go back to my first question about why it's a key factor now that the vaccinations are happening, because when you look at typhoid, measles, and rubella, they're very specific, right? So there is an outbreak. We've showcased that in our news time and time again. But there are counties which are more affected than others. What are those factors that are making other counties more susceptible, than the others?
If you start with typhoid is a disease that gets called of that. Yeah? Some people call it fecal oral.
Yeah.
So if you find a place where the hygiene is low, where the water supply is not clean, where the food vendors are not probably clean, the way they prepare the food and so on, you'd find that the cases go up. So you find places like slums or the dwellings that are not organized, is much higher because water supply there is poor, it's crowded, and so on. If you look at the mumps and rubella, that is just, it depends on, if you look at every year, the countries that have the percentage of vaccination is different in different counties.
Yeah.
And we are hoping that they can all go to around to a higher figure.
What do we have on the ground now when it
Right
comes
now
to
it's
the
about
figures?
80% for the first one, and probably 60% for the second dose. For the second dose, and that's extremely low. And as I mentioned earlier on, the numbers now of unvaccinated becomes bigger and bigger. And mark you, even for the 80% that have been vaccinated, not all of them are immunized. So it doesn't take. That's why we repeat, and I repeat, even 3 or 4 times will not harm you, because you are always being introduced to a new antigen every day.
A new antigen
every day when you're eating food, when you're eating something else, or beating something, there's an antigen that's always going into your body. So we cannot say that it can be overwhelmed by the number of antigens that you are given. The antigen is the vaccines. that are being given into your body. There's no time you can say that you can be overwhelmed by the antigens that are being given.
Got you. I think it's also quite key here that we have such a level of distrust. Like I said, this has happened from way back in the 90s, so it's not new that we're meeting parents or caregivers with such questions about why right now, why the vaccines, right? So for you to dispel that, where do you feel is the root genesis of such distrust? Also,
I think there's some people who just don't believe in probably big farmers because they think that it's profit driven or so on. But then the vaccine by and large, I can inform the viewers, they are safe and extremely safe, and they will actually reduce. When I was young, when I was a medical doctor, I can show you that we used to have a ward in Kenyatta National Hospital that was full of measles. That some of them could not breathe until we had to probably put a tube into the airway so that they can breathe. We don't see it anymore. The cases I was telling you about, it's called SSP, which is the brain that is getting damaged weeks after. I've not seen a single case again since I was a student.
So there's been more awareness.
Many people are being vaccinated. The problem is the small number that are not getting vaccinated for whatever reason. Some of them is just because they don't think it's important. A few of them are the ones who are against it, and for reasons that probably they get a lot of information from social media and other areas that are not factual. It's better if they go and talk to their doctors or even read from factual sites, not just for social media.
Okay. Yeah. And then now, of course, you'll tell us more on how to get, the factual information and where to actually, get it from. But first, I want to read for our viewers our question of the day. We're asking you, as a parent, what are your concerns about the intended typhoid, measles, rubella vaccinations? As a parent, what are your concerns about the intended typhoid, measles, rubella vaccinations? Would love to know your perspectives on the same. If you have any questions, if you have any concerns, our WhatsApp line is on your screens, and our handles on X and Facebook are the same, and that is at K24TV. Once again, our question of the day is, as a parent, what are your concerns about the intended typhoid, measles, rubella vaccinations? As a parent, what are your concerns about the intended typhoid, measles, rubella vaccinations? Tell us your perspectives. Share with us your concerns, questions. We'd tell our doctor, of course, in studio to answer you on whatever they are. Our WhatsApp line is on your screens, and our handles on X and Facebook are the same, and that is at K24TV. Would love to know your perspective on the same. Right, so doctor, I think it's very crucial what you've said, getting the right information concerning vaccines. We've also come from COVID. There was also a lot of information on social media, that was against getting the COVID vaccination, if you remember back, during that time. But also it's the same thing right now, anything that has to do with a vaccination world over, not just in Kenya, it's quite a concern. So where do you get the right information concerning the vaccines you're about to get?
Especially in Kenya, I think the people in the medical world, because right now the nurses, the doctors, they've all been trained. We have also trained a large number of CHPs that are there, the community health promoters, who go right into the villages. We have trained them, and then if you want to read scientific, there are scientific websites that you can actually go to, search engines that you can get that information, and not just generally just googling and getting all the information that in that particular area. So if you go to those search engines, some of them they're called PubMed, you can actually be able to get proper information in that area. But even if you get those information, you should be able to know how to read it. You're supposed to look at whether, I'm a researcher, problem going there. You have to look whether the design was done properly. You have to see whether the analysis was done properly. You have to see whether the conclusion is supported by the data. Because somebody will probably they already have their conclusion, and they're putting something there to try and
but
support
it's
their
not
conclusions,
factual.
which is not factual.
So in a layman way, and I love the fact that you said you're now speaking as a researcher. In a layman way, how is someone to go about all that? Because that's a lot of information, and for some, it's very overwhelming. You know, do you go to your, you know, closest clinic or health facility and find the information? How do you break it down?
If you just go to any of your health service provider, they'll be able to inform you. So all the nurses, I think that the community health promoters, I think they're now being paid by the government. They are found in all over. They've been trained in that particular area there. The medical doctors, and they can be able to talk to you. So if you go there, go ahead and ask the right question. If you still think that you need to do more, that's when you can go and read. But reading is a bit complicated. You don't have to read probably what you call the primary paper. They are papers that people have brought all them together. They're called systematic reviews. If you read that one there, it will give you all the steps that be done in that particular area, so that it doesn't have any biases. But generally, just go to your health providers and she'll be able to inform you.
Okay. Yeah. Speaking still about information, also the myths are coming from a place where people are getting sensationalized, you know, in a very, let me say, concerning manner. Because even if I have the right information, like you said, speak to your health practitioners, do they also have training to calm someone down? You know what I mean? Because you see, I may come to you, I have maybe facts and everything, but I can be delusional because I'm also scared for a various number of factors. So I would want to assume that you have training to be able to allay my fears and to articulate certain things. So do we have that also when it comes to articulating, okay, mtu anajua kenye anasema lakini maybe tu nikuogopa acha nimweleze hivi?
It's an area that we have been having a problem. I remember discussing with one of the lecturers that we should increase that training among our medical people, so that there are kind of discussions, different. Because sometimes you find you're overwhelmed, you are at a high speed, you're probably telling somebody facts without listening to their fears.
Yes.
So it's something that the training is ongoing. For this particular campaign, there was actually that aspect was put in, so that you can be able to explain and ask all the questions before you start. And even when their parents are informed, it was their right to even come back and get more information. And if they're there, they can even stop vaccinating, just talk to that one person to make sure that one person understands. Because that one person, if he doesn't understand, he'll inform the others and influence the others with the wrong information.
Exactly, that's true.
Yeah.
Yes.
And we had found one mother who had refused the child to be vaccinated. And when you're discussing with her, just the field, I'm from the field, and when discussing with her, there was somebody who said, even me, I can never vaccinate my child because he got a swelling after being vaccinated when he was young. And then when he looked at the finger, the child had been vaccinated. So you can see he's trying to influence the other one not to be vaccinated, and yet her child has been vaccinated.
So what is the point?
I don't know. I don't know what some people's points are. You know, they just want to be negative, but they're like, kill your mother, but they don't kill mine. So if somebody even is coming an anti-vax and they themselves have been vaccinated and telling you not to vaccinate your child, I think it's not right. It's not right. In fact, even when they refuse, we do listen to what the mothers say, but wonder if it is the right also of the child. Even though now we don't force them, the mother refuses, will stop, but the right of the child is being interfered with. Also.
Okay, then. Right, so in regards to our question of the day, I do understand that we have some feedback from you, and I want to read a couple of them, and of course see what you're saying, see what the doctor can be able to respond to you, of course. And we had asked you earlier, with the intended typhoid, measles, and rubella vaccinations, what are some of your fears or concerns? And we have Mary from Nairobi who says, as a mother, my biggest concern is about the safety and possible side effects of these vaccines. I would like to be fully assured that they have been properly tested and are safe for our children. We just want to protect them, not expose them to new risks. So doctor, have that in mind. That's from Mary. We have John from Kisii who says, I fully support vaccinations, but my main worry is whether the health workers are properly trained to administer them correctly. We have seen cases where vaccines were mishandled, and that really scares us as parents. Okay, John, what I'd ask you also about. So thank you so much for that. Have that in mind, doctor. Susan from Nairobi says, my concern is about the information being shared with us. Many parents don't have enough details about the vaccines, which leads to fear and misinformation. We need more awareness campaigns so that we can make informed decisions. That's from Susan. Okay, right. Okay, then. Right, so with that perspective, you know, doctor, what most of our viewers are asking is we need more information. We need more awareness, okay? And are our health workers also properly trained to administer these particular vaccines? Right before we began the conversation, I remember telling you that some of the concerns is, you know, if I'm going to take my child to get a vaccination, are those health workers, you know, sticking to hygiene standards that are, you know, needed in that particular, you know, moment? And how does the health standard supposed to look like? You know, what am I supposed to be aware of? What are they supposed to be doing to make me feel comfortable and happy, you know, to even take my child to administer, to get those particular vaccines?
The ones who are vaccinated have been trained before. But even before the campaign, we had a whole 1 or 2 weeks training, all the health workers. And right now, no one is allowed to vaccinate if they are not undergone that particular, even if they had the training before. So in terms of even looking at the bottle, you see the bottles that contain the vaccines, there is even a marker. If it gets spoiled, it's being thrown away. So it's and then the way how to use, reuse, or even throw away, there's all that training has been done. So there's no one who is vaccinating who has not been trained. And if they are not trained in that particular area, they may be helping other things like writing papers, doing whatnot, but not in that particular area there.
But how can you be sure? Like, do you know, or the ministry at large, or those in charge do a check, you know, a round check to make sure that these health workers are administering or adhering to conditions needfully?
Each team has got a team leader, and then there's also a supervisor who walks around and just confirms that whatever he is doing. And then there's also independent people. Like, I'm independent. I'm not part of it, even from WHO, other places. Independent people from elsewhere. Okay. So they just walk around and really see that what they're saying is actually true. And then all the vaccination before we take it, we actually check all the data that's been published. And we're from Kenitag, we look at all the data that is there. And so the quality of those vaccines are of the highest standard before they can be allowed. And the safety has been checked.
That is from the data?
From the data. Yeah, from the data. So that the safety, we can know if there's any side effects, and how much is that effect, is it acceptable? And yeah, so all those things have been checked. How can it be kept? Do we have the facilities to keep them and keep it in good condition for the period that is there? So and we have the number of people to vaccinate it, to do the vaccination. So we have checked all those things, and you can see the one for typhoid is the first time we are giving it in public. And from now on, we'll be giving it on routine from 9 months.
Okay.
At 9 months, sorry.
All right. And those vaccines that are traveling to far off places, counties, and the like, so the same care.